Dr. Tamisha Denis of Modern Smile and Implant Center, and today I am in one of my operatories, and I'd like to talk to you about our dental 3D imaging machine, and also about what the images like that look like. So in modern day dentistry, we have the advantage of being able to see things in 3 dimensions. So in a traditional x-ray, what you see is 2 dimensions. That means up and down and this way. But with a 3D image, we're able to see things in 3 dimensions in which I can rotate and see that in all different angles. So I'm going to show you what one of those images look like today so you can get a better idea of how dentistry and 3D imaging looks like. This is what typical dental x-rays look like, and I'll make some of them a little bigger. So this is what it looks like. It's in 2 dimensions. There's no rotation, nothing like that. And you can kind of see the different, that's that same wisdom tooth in 2 dimensions. So it's a drastic difference between what you can see in 3D. And I'll show you what a 3D image, for example, that wisdom tooth, how different that may look in 3 dimensions than it does in a 2-dimensional image. Typical scans you'll see in our office. At the top, you're going to see what most people would consider a panoramic image, which basically is still a 2-dimensional image, up and down, right to left, with no 3D. You can see a preview of a 3D down here at the bottom. This person has braces, so that's why you can see that. And then a preview of the pen. But here's the really cool part. If you look here where it says volume render, and this is something that I show all of my patients when they come in, is a 3D interpretation of the patient. And you can kind of see the spine, you can see almost where the nose is, where the sinuses are, and right over here you'll see an impacted wisdom tooth lying down sideways. On the other side, same thing. And it's really cool because we're able to move in multiple dimensions, and I'm able to manipulate this image so that people can see themselves in a different way, and it helps me to plan for different kinds of surgeries, for implants, for wisdom teeth. See all different ways. Very, very cool. The really great thing about having 3-dimensional images in dentistry is that we are able to track the nerves. So they're very important nerves. It's called the inferior alveolar nerve. And I'm just manipulating this while I'm talking right now. And that nerve is really important to give movement to the tongue, taste to the tongue, feeling in the chin, and all kinds of things. And when we're placing a dental implant, it's really important for us to know where that nerve is so we can avoid it. Here you can see these are the sinuses and everything like that. So here I have something that says nerve, and I can actually trace the nerve all the way. And what I can do is in different dimensions, I'm able to see kind of where that nerve is and follow it along the pathway until eventually I can get to the front of the mouth, which is really cool. So there's a little hole here, right there. And then I press done, and then we can see where the nerve is. And if I go back to this other image, I can actually see where I've traced the nerve. So the great thing is that I can actually make measurements. And I always say, so here to here, 10 millimeters. So what happens is in dentistry, when you take an image that is for regular x-rays, and I'll show you what a regular x-ray looks like, it's a little distorted. But when you take an x-ray in 3D, it is a 1-to-1 ratio. That means a millimeter is really a millimeter, which is really cool. Here's another really cool thing that we can do with our x-rays. We can kind of change the way that it looks. You can put the face back on. So this is what her face looked like when we had it on. Just different ways so I can kind of see different views of that. And then the other really cool thing we have is also called implant, which means that I can add an implant. Let's say I wanted to add an implant to a front tooth. I can actually virtually place the implant. I can rotate it. I can say this is where I want it. I can play with the angles and tilt it. I can look at the bone quality. I can make it longer. I can make it shorter. I can choose different sizes.